our Minister of Finance, Planning and Economic Development, Honorable Maria Chiwanuka, will deliver a third national budget speech for the financial year 2013-2014. And as a nation, we all highly anticipate the reading of the budget. And as civil society organizations, we all have expectations in terms of what the budget should cover in the different sectors of the economy. Under the umbrella Coalition on Civil Society Budget Advocacy Group, CSBAG, we anticipate the budget for this year to generally focus on growth of primary sectors such as agriculture and health, to strengthen the relationship between macro and micro economies, to indicate an appropriate fiscal policy, and also to address inequality within the population. And we also have specific expectations. We also note that in the agriculture sector, this is the most important sector where source of employment for most of Ugandans lies. About 68% of Ugandans derive their livelihood from this sector. We note that this sector's performance has steadily declined from 7.9% in 2001 to the current 3.1%. We desire that the Minister announces a landmark budgetary increase to this sector from the current 3.3% to 6%. And we hope that this will go towards institutional strengthening of the Ministry of Agriculture, Animal Industry and Fisheries to enable it deliver on its mandate, but also to establish an agricultural credit bank and prioritizing mechanization towards small-scale farmers. We welcome some of the increments that the government has done towards primary health care, specifically for the local government from 42.2 billion Uganda shillings, which is about 17%. But we propose that in the minister's speech, we get an increase in the entire health budget to sufficiently cater for health centers in all our 112 districts. And this should be also going towards supporting the Uganda blood transfusion services that have suffered an acute blood shortage, but also towards addressing the quality healthcare gap between the urban and rural areas, and also towards reducing infant and mortality rates and epidemics like Ebola and Marburg. We furthermore desire that the minister's speech will introduce the National Healthcare Scheme because its absence is a major risk to our government. Funding under the water and environment sector is more urban focused, and yet the biggest needy population lies in the rural areas, or those areas which are hard to reach, hard to stay, and hard to come out. Areas such as Mpungu in Kanungu, Zaipi in Ajuman, Kapak in Moroto, and many others. We hope that the minister's speech will announce a substantial revision upwards to cater for increasing demand for sustainable natural resource management and adaptation to climate change impacts. On education, there's already a reduction in the school inspection functions and quality issues. We wish that the minister's budget focuses on supporting the Education Standards Agency, and then the construction of teachers' houses and increment to teachers' salaries as promised in the last financial year budget. We further hope that there will be a gender balance in teacher recruitment, as some schools have male senior women teachers. Under the road fund, we hope there's a projection that this will grow from 280.1 billion to about Uganda shilling 352.8 billion, which is an increase of about 25.9%. And this is good news, but we hope to have the status of road infrastructure in districts and communities improving. But we note that the road sector has experienced challenges, And we hope that by getting this support, such challenges will be addressed with the budget allocation in the financial year 2013-2014. We hope that the Minister will also announce a 20% budget allocation to the Ministry of Gender, Labour and Social Development. This is a ministry which houses majority of the vulnerable groups. If you didn't know those groups, those are the children, people with disabilities, older persons, the women, the youth, and many other groups. We hope that the Minister will make a landmark announcement in her speech to introduce an enforcement mechanism to ensure that the budget post-circular directive on gender and equity budgeting is adhered to by all sectors. We also note that the President made a statement when he made the State of the Nation address, indicating that Uganda will be becoming a middle-income country. But we also note that this can only happen where inequality and vulnerabilities are tackled to sustain the already achieved economic growth. We note that under the social protection subsector, we would like that the government fulfills its commitment of counterpart funding towards the senior citizens grant, but also roll out the senior citizens grant to all the districts. It's currently in 14 districts, being implemented in 14 districts. We also hope that there will be resources on emergencies and disasters, such as landslides, floods, and other natural disasters, and look at it from a social protection perspective. We also hope that the resources that are envisaged from the oil sector will be directed towards contributing to financing the social protection system. We hope that the Minister's speech will also address the issues of the public finance management in Uganda. Misuse of public funds is the main challenge for Uganda in its execution of the budget. Furthermore, supplementary appropriations continue to benefit public administration and security sectors, and depriving the social and productive sectors of the much needed resources. Supplementary budgets not only subject the budget to allocative inefficiency, abuse, and misuse, but they undermine the budget credibility and the spirit of budget consultation processes. We are concerned that the NDP, that's the National Development Plan, as the planning framework for the country, is not being consistently implemented. Public investments in some areas are aligned to the NDP, while in others they are not, especially in the productive sectors. This is notwithstanding the limitations that the NDP is experiencing, especially the to do with financial strategies, which did not envisage the economic reality and government's own expenditure plans and time. There is an additional tax on fuel, which has been talked about, and this will directly increase commodity prices and production costs. We hope that the Minister's budget speech rejects the proposal to impose VAT on domestic water, as this will also exacerbate the already poor access to water for the urban poor people, and will affect women and girls more than any other population group. This tax proposal should be fair and promote local investment for improved productivity. I would like to end by pointing out that as the civil society organizations under the Civil Society Budget Advocacy Group, we urge you that on 13th June 2013, you listen, take note to the Minister's promises to Ugandans, and use these promises to ask our government to deliver on the promises made in financial year 2013-2014.
When we talk about the budget, when we talk about the budget conference, we are not playing around with issues of governance. We are talking about issues that affect the citizens of this country. And we are calling upon all Ugandans to keep watching. The budget is your budget. It's not the minister's budget. And I want also to say that the minister is going to read the budget simply because she is delegated by His Excellency, the President of this country. And that means the president has all the powers to see that issues that affect the citizens are addressed in the national budget. When you look at health, out-of-pocket spending is around 43%, which is affecting the poor Ugandans. And when you look at the investment in health, for example, I can see only 8% being allocated entirely from the national budget. So what does that mean? It means that the poor people who are paying taxes must invest out of their pockets to meet their health needs. And this is a very serious violation to right to health, which the government must address. We are seeing many mothers dying out of preventable issues, which the government can come in and address. We are seeing health workers not really motivated and recruited to ensure that the health system is working. This is very critical. We are talking about national health care system. For the last 5 years, we have not seen the government coming up to execute this document. We don't have even a national health insurance policy in place. When you look at the national strategic investment plan, this is clear-cut. We are reaching 2015 in the next 1 year. What does that mean? It means Uganda is not going to achieve the targets. We have so far seen the country doing badly in achieving MDGs, especially in issues of maternal health and HIV and AIDS. We have seen the prevalence of HIV/AIDS increasing from 6.4 to 7.3%. So what does that mean? It means the government is not doing its role. And I would like also to inform the government that investing in health, investing in agriculture means you are preparing the country to go into a middle-income country. You cannot talk about going to a middle-income country when the health indicators of the country is doing badly. Having healthy and productive citizens means we are able to engage in agriculture. We are able to engage in any other productive events that can take the country further. So we call upon His Excellency, the Minister of this country, to ensure that issues that civil society are putting upon in this pre-budget press statement must be considered. And we are calling upon every woman and man outside there to watch. Hold these people accountable. We need a budget that is propoor, not a budget that is not going to address the needs of Ugandans.
On behalf of Uganda Water and Sanitation NGO Network, would really like to add our appeal to the nation, and beginning with the speech that the President of the Republic of Uganda gave. Here, the President clearly stated that hygiene is very, very important if we are to uphold and also reduce the disease burden within our country. In his speech, he clearly stated that if we took up hygiene and really prioritized it, would be able to reduce the disease burden by 80%. As an NGO network, would really wish that this is also reflected within the budget allocation. So we really expect that the water and environment sector will be prioritized from the speech that will be given tomorrow, such that this does not contradict with the President's speech. We also like to call upon a collective effort towards addressing issues of hygiene and sanitation, because from the speech it was clearly stated that it requires an individual effort as well as a collective effort, and this means that all sectors need to look into issues of hygiene and water, because it is a cross-cutting issue. We'll appreciate that Uganda as a country scored 65% in 2011 in terms of water coverage. But as you look at the sector performance report of water and environment, the one of 2012, the performance has actually fallen down.